Let me thank Doctors for America for inviting me to speak to you today. And let me thank everybody in the audience for the extremely important work that you are doing every single day. Saving lives, easing suffering, and keeping people healthy is what you do. And I can't think of anything more important. Thank you very much. As chairman of the Senate Health, Education, Labor, and Pensions Committee, let me be very blunt. The healthcare system in America is broken, it is dysfunctional, it is wasteful, it is cruel. Despite spending twice as much on healthcare as almost any major country on earth, over $13,000 per capita, 85 million Americans are uninsured or underinsured. Over 60,000 Americans die each year because they can't afford to go to a doctor on time. And over 500,000 people face bankruptcy because of medically related bills they can't pay. Further, we have one of the lowest life expectancy rates in the industrialized world. And there is a shameful, disgraceful gap in longevity between wealthier Americans and the poor and working class. In other words, poverty in America is a death sentence. In addition, we pay by far the highest prices in the world for prescription drugs. As a result, 1 out of 4 Americans cannot afford the medicine their doctors prescribe when they are sick. How crazy is that? And on top of all of that, we spend far less on primary health care than do the people of other countries, because the function of our system is not to keep people healthy, but to treat them when they're really, really sick. So the reality is that while the healthcare system in America is failing patients, it's failing our doctors, it is failing taxpayers, it is doing extraordinarily well for the people who own the system. Now, that's an issue we don't talk enough about, but we should. While tens of millions of Americans cannot afford the health care and the prescription drugs they desperately need, the pharmaceutical industry and the insurance companies are making record-breaking profits and paying their CEOs exorbitant compensation packages. What I appreciate about Doctors for America is that you understand that the function of a humane and rational healthcare system is to provide quality healthcare to all in a cost-effective way, not to make huge profits for the people who own the system. And that is why you believe, as I do, that healthcare is a human right, not a privilege, and that we must guarantee healthcare to every single person in our country. The task in front of us as we move toward that goal is not easy. We are up against some of the most powerful special interests in America. They like the status quo, and they're going to fight to maintain the status quo. The pharmaceutical industry alone has over 1,800 well-paid lobbyists on Capitol Hill, including former leaders of both political parties. Since 1998, the healthcare industry has spent more than $10 billion on lobbying, and over the last 30 years, it has spent more than $1.8 billion on campaign contributions in order to get members of Congress to do their bidding. Now, that's the bad news, but here is the good news. And the good news is that the overwhelming majority of Americans know that the current healthcare system is broken and they want change. And with the support of physicians like you, we will create that change and in the process transform our country. Think about it for a moment. Think about what an extraordinary sense of relief it will be for hundreds of millions of people in our country when they understand that when they get sick, they can go to any doctor they want, they can get the health care they need without worrying about the cost. What an enormous sense of relief that will be, and it will create an extraordinary improvement in the life of our people. So let me conclude by thanking all of you for what you're doing. It is extraordinarily important. We appreciate it. Keep up the great work. and I look forward to working with you. Thank you.